As the country continues to be divided over the approval of the National Health Insurance Bill by the National Council of Provinces, the bill is now a step away from being passed, as it is before President Cyril Ramaphosa, who is expected to sign it into law. It's been criticized by some players in the health sector, the business sector, and opposition parties. The legislation establishes the legal framework for government's universal health policy, which intends to do away with South Africa's two-tier healthcare system and guarantee that all patients receive free services. For more on this story, I'm joined by ActionSA Chief Strategist Coetzee for some reaction to this development. Andre, thank you for making time for us this afternoon. What concerns you the most as ActionSA about this bill?
Good afternoon, Chairman, and thank you for having me on your show this afternoon. Look, I think it's important to state from the outset that ActionSA supports reforms to the public healthcare system. I think there is no denying the inequality and disparity that we see between public health and private health. But the National Health Insurance Bill is simply not the solution to this. Apart from the fact that it has been hastily rushed through the parliamentary process, ignoring most of the public inputs that were made during the public engagement outreach process, the South African healthcare system is simply not ready to do away with private healthcare. ActionSA just fundamentally believes that instead of trying to nationalize private healthcare, we should ensure that the public healthcare system is improved by improving the management thereof and doing away with corruption. And the NHI, as noble as the idea might be, simply doesn't address these challenges.
Yeah, and obviously the state of the healthcare is important in us talking about the NHI. And I mean, you talk about how noble the idea is, right? What government is trying to achieve here is guarantee quality, accessible and affordable universal health coverage for all South Africans, which is noble. But is the public health sector ready? I mean, the quality of health delivery in our hospitals has been deteriorating, and one wonders if the hospitals will meet the high standards required by the NHI, because many of the health facilities have been failing the norms and standards that health institutions need to comply with before the NHI is implemented. So from your assessment, how ready are our facilities for NHI? How ready is the public health system? Is it anywhere close?
No, and I think that's exactly the point. In fact, if you look over the past 20-odd years, the expenditure on healthcare as a percentage of GDP in South Africa has actually increased. But despite this, the quality of public healthcare has gone down. I mean, we see stories of hospitals that are entirely under-resourced, they don't have generators during load shedding, lack of water. I mean, these are facilities that are fundamentally not able to provide quality healthcare. Now, the NHI makes the assumption that if we simply pump more money into the system that you're going to solve this. But this is not simply a question of funding. This is a question of management.
Yeah.
And unless we address the underlying management concerns, simply taking more money for the system isn't going to improve the quality of our institutions.
Yeah. Well, the process to realize the NHI may still take years to complete. So maybe that buys government time to sort out what needs to be sorted out? Because even the health minister says they're already doing some work, particularly in many communities around improving the healthcare services in the clinics. And before this is realized, more work would have been done to improve the quality of healthcare in South Africa.
Look, I think no doubt that the NHI or the phasing in of the NHI is going to take decades, and even government acknowledges that. But I think my concern, and certainly the concern of ActionSA, is that if we look over the past 30 years since 1994, the public healthcare system has deteriorated, and that is specifically the result of corruption and mismanagement. So it is very difficult to take at face value the promise from a corrupt and incompetent government that they are going to suddenly improve the system over the coming years and get it ready for NHI. If we look at the failures at Transnet, at SASSA, at Eskom, the government is simply incapable of running large, complex institutions. So as much as, yes, they say we are buying time, ActionSA simply doesn't believe that that time will do anything other than make things worse. It certainly won't make our healthcare systems ready to do away with private healthcare in its entirety.
There are other things that are still not so clear around the NHI Bill, well, at least for some South Africans and some stakeholders. For instance, the issue of funding. Do you get a sense that there's enough clarity around that? Is South Africa even in a financial position to fund the NHI? I mean, the Minister of Health, that is, suggested that there may be a need for an additional tax to fund it.
Yes, and I think the challenge with this approach is that South African, especially South African middle class, is already taxed to the hilt. I stand to be corrected, but I believe the recent statistic from SARS is that only 190,000 individual South African taxpayers paid 90% of income tax in South Africa. And the ability to further increase taxes on this group to support a country where we have 2% unemployment is simply not feasible. So I think the idea of introducing additional taxes is not feasible. And if the principle is that we will take what is currently being spent on private healthcare contributions and direct that to the national healthcare insurance system, again, this comes back to the question of whether the government is fundamentally capable and ethical enough to use this money for the intended purpose. If we look at the corruption during COVID, I think South Africans simply don't have any faith in the National Health Department. Yeah.
What do you want the President to do then? Because he can either return the bill to Parliament and say there are procedural issues or there are concerns that it may not meet constitutional muster, or he can refer the legislation directly to the Constitutional Court, perhaps for a decision on its compatibility with the supreme law. What do you expect him to do?
So on Friday, ActionSA, our President, Herman Mashaba, actually wrote to President Cyril Ramaphosa asking him not to sign the NHI Bill into law. We believe it should be returned to Parliament. But importantly, it must be returned to Parliament so that the legitimate concerns that were raised during the public consultation process can be taken into account. If you look at the bill that was eventually voted on by the National Assembly and the NCOP, it was largely unchanged from the first draft, which meant that it entirely ignored the legitimate concerns that were raised during public consultation. And Parliamentary's legal services even flagged to the committee that it had fundamental legal issues and was open to a constitutional challenge. We know that a number of private medical aids are gearing up to fight the bill and the constitutionality thereof. So I think in this environment, the President has to do what is best, and that is to send the bill back to Parliament. We doubt he will do this because clearly this is driven by election expediency ahead of next year, and not by really the interest of ensuring that we have decent access to universal health care. So politically, we expect him to probably sign the bill, in which case they will be facing 4 challenges, and that will just have to play out.
Okay. Well, Andre Coetzee, ActionSA Chief Strategist, thank you for making time for us this afternoon.